I wanted to talk about headaches for a minute. My background is a chiropractor, and over the years, I've been practicing for 28 years, although we have a medical clinic here where we do a lot of functional medicine. I have medical providers that work here, nurse practitioners, PA. So as a medical clinic, it's kind of a little bit different than you would normally see in a chiropractic office where you have the chiropractor and maybe his support staff there. So we have a much different clinic. But I've been practicing for 28 years, and I've seen thousands of patients with headaches. And I can count on all my digits the number of people that I have not been able to help improve their headaches. And I wanted to talk about this for a second because the research shows that somewhere around 80% of all headaches are considered tension. 80% of all headaches are tension headaches. Another 10% of headaches are called cervicogenic, meaning they stem from a problem related to the neck. So if we're talking about muscle tension and the neck problems, which are related, that's somewhere around 90% of all headaches are caused by something related to this area here. So not everybody watching this is going to be from Middle Tennessee. Not everybody watching this is going to come to Magnolia Medical Center. I just want to let you know that if you're a headache sufferer, it would be good for you to consider looking at maybe chiropractor. Again, that's my background, but somebody who can really evaluate your head and neck properly and understands joint mobilization techniques like chiropractic adjustments, how to handle the muscles, how to handle muscles that are too tight, how to handle muscles that are too weak, how to evaluate them to know what type of exercises and stretches you should be doing so you don't always stay tight. Somebody who understands how to help you handle your posture, because most of us, like I'm doing right now, are sitting at a desk all day, or we're driving long periods of time and our posture's contributing to tight muscles. Somebody who understands how to help you handle your stress levels, maybe looking at your adrenal glands. I'm letting you know that there's so much you could do if you're a headache sufferer. You just don't have to pop Tylenol and Advil and ibuprofen and things like that all the time. Those things are horrible for your gut, they're horrible for your kidneys, and they're horrible for your liver. Not to mention other things in your body, which if they're horrible for those things, it's sooner or later they're going to be horrible for other things in your body. There's other ways to handle it. Somewhere around 90%, according to the research, of all headaches are going to stem from a problem related to the neck itself, the spine, the nerves in the neck, or the muscles in your upper back and neck, which means 90% chance that if you go see the right people, you can significantly reduce or improve or maybe even eliminate your headaches. Stop suffering. I'm Dr. Dave Morris at Magnolia Medical Center. I hope you found this helpful.